My name is Rishi Agarwal. I'm a gastroenterologist with Birmingham Gastroenterology Associates and Grandview Endoscopy Center, and I'm here today to talk about colon cancer screening. March is Colon Cancer Awareness Month, and we wanted to take a few minutes to talk about why colon cancer screening is so important. Colon cancer is the second most common cancer when combined with men and women, and is actually one of the most preventable cancers out there. It is responsible for over 50,000 deaths per year. And when we talk about colon cancer screening, we really should be talking about the gold standard, and the gold standard is colonoscopy. Colonoscopy allows us to look for precancerous tissue and actually remove them. And that's really the game changer for colon cancer care. Out of all the tests available for our patients over different types of disease processes, colonoscopy is one of the few tests that allows us to not only detect cancer early, but also prevent cancer. And that is allowed for gastroenterologists to really provide exceptional care for patients over the last 20 to 30 years by being able to take a colonoscopy and remove abnormal tissue known as polyps that can be harborers of cancer and actually develop cancer later. When we talk about screening, the two most common methods are via colonoscopy, which is the gold standard, and then stool-based testing. Colonoscopy is typically a test that is originally thought to be recommended to start at the age of 50, but new information has been coming out that patients that are younger than 50 are at a risk of colon cancer as well, so the new recommendations are actually to consider starting screening at the age of 45. And that will definitely impact the population, but will also lead us to prevent colon cancer at an earlier age. The other big part of this is that colonoscopy in an average risk screening patient can be done in every 10 years versus stool study tests that are typically having to be done every 1 to 3 years. The reason that colonoscopy is the gold standard is mainly because of the method of not only detecting but also preventing cancer. And it's what I consider a one-stop shop. You come in, you get your procedure done. If we find precancerous polyps, we're able to remove them in real time, and then you're able to go about your day. With stool-based testing is really a two-part test where you come in and you have to have the stool study collected, and if it's positive, then you'll end up having to get a diagnostic colonoscopy rather than a screening colonoscopy to actually look and see why that test came back positive. I also wanted to talk about the importance of colon cancer screening during COVID. The most important take-home point about this is that even during the pandemic, it is very important for patients to still get screened. And it's important that patients know that it is safe and effective for patients to still come in and get a colonoscopy during this time to look for precancerous polyps and colon cancer to prevent cancer from happening. We really want our patients to take charge of their own healthcare. We want them to go to their healthcare providers, go to their primary care doctors, and ask for screening for their colon cancer, and ask to have it done via colonoscopy as the gold standard that's been recommended for decades. Also, the big take-home point that we ask for our patients is to always think about a symptom that they're having and to have it worked up, whether that's rectal bleeding, change in bowel habits, weight loss, abdominal pain, anything that's a change from your usual GI symptom is something that really should be worked up, especially if you're over the age of 40 to 45. We really recommend you coming in to see a gastroenterologist or your healthcare provider to be evaluated, and then consider if you would need a colonoscopy for those symptoms. My last take-home point is that colon cancer is preventable and it's treatable, and you just need to call your healthcare provider and get scheduled for your colonoscopy if you're over the age of 45. Have a great day.